guys, today we are going to discuss about arsenic poisoning. Arsenic, when it is in the pure form, normal arsenic, it is not toxic, but this arsenic gas is most toxic. After that, arsenic trioxide, trivalent arsenic compounds like arsenic trioxide, potassium arsenite, sodium arsenite, these are very toxic after the arsenic gas. Okay, arsenic, where we will use this arsenic? Pesticides, in rodenticides, and widely used in timber preservatives, glass production. Okay, it is natural contaminant of groundwaters in many parts of the world. Sodium arsenite is usually used as ant killer. Melarsoprol is used to treat the trypanosomiasis. Trypanosomiasis is caused by, which is African sleeping sickness caused by Trypanosoma gambians, remembered from micro. So arsenic trioxide, there we to treat we will use arsenic as melarsoprol. Arsenic trioxide is occasionally used to treat the relapse of the acute promyelocytic leukemia. It is metallic irritant. It causes inflammation, necrosis of intestinal mucosa, and hemorrhagic gastroenteritis. Okay. Trivalent arsenic, it binds with the sulfhydryl groups of the mitochondrial enzymes. Even lead also binds with the sulfhydryl groups of the enzymes. This also binds with the sulfhydryl groups, and it causes the uncoupling of the oxidative phosphorylation. So acute poisoning, GIT manifestations are metallic taste in the mouth, nausea, vomiting, colicky abdominal pain, garlic odor in the breath. Initially blood-stained diarrhea, later it becomes diffuse watery diarrhea. It resembles the rice water stools. And cardiomyopathy, arrhythmias are common in CVS manifestations, and fatty degeneration of the liver, hepatic system also involved, shock, renal system also involved, and renal failure, hepatic failure, hypothermia, hypothalamus also getting affected, loss of hair, alopecia, convulsions, coma, and death. Okay. So how we will diagnose it as arsenic poisoning? So we will do X-ray abdomen, and we will see even we'll ask for serum. We will go with serodiagnosis, where we will see elevated serum and urine arsenic levels. Okay, urine examination, serum examination, we will find this. And best analytical method is atomic absorption spectroscopy. Okay, how do you treat the patient? Hemodynamic stabilization. First, you have to stabilize the patient hemodynamically. Later, to prevent further absorption, you should do gastric lavage with not with charcoal, with warm water and milk. After because here activated charcoal is not effective. Okay, demulcents should be given. After that, whole bowel irrigation with polyethylene glycol. Okay, dimarcaprol is also known as British anti-leucine, which is chelating agent of choice to chelate the complex and to eliminate it. And DMPS are preferred, as they do not cause the accumulation of arsenic in the brain. So chronic poisoning is also known as arsenicosis. So usually occurs as occupational hazard who are working with the paints, dyes, cosmetics. Okay, arsenophasis means some people take arsenic daily as an aphrodisiac for increasing the sexual pleasure. So they acquire some tolerance to 250 to 300 mg or more in one dose. They are known as arsenophagists. From contaminated groundwater also, as we saw before, sometimes in some parts of the world there is arsenic in the groundwater also. So from there also there is possibility of chronic poisoning. Clinical features: loss of weight, loss of appetite, colicky pain, constipation or diarrhea, coated tongue, raindrop pigmentation, speckled brown pigmentation on the skin flexures, temples, shoulders, eyelids and neck. Leucomelanosis. Leucomelanosis means white color. What is becoming white color? Skin. Okay. Sometimes areas of depigmentation on the normal or hyperpigmented skin will be seen. Hyperkeratosis of the palms and soles. Normally keratin will be present. No, it is means palms and soles become very thickened. Okay, their average means lines. These are characteristic white bands of opacity which are seen on the nails of the fingers and toes. Anemia will be seen. Leukopenia, thrombocytopenia also will be seen. Peripheral neuropathy, sensory and motor will be seen. So it manifests as numbness and tingling in glove and stalking distribution. Okay, means it will come and go like that. And serious manifestations: hypertension, ischemic heart disease, cardiac failure, kidney, renal system involvement, there is chronic nephritis, even gangrene will be seen, black foot disease will be seen in chronic poisoning. Postmortem examinations: rigor mortis lasts longer, it delays putrefaction, red velvety appearance of stomach mucosa, submucous petechial hemorrhages will be seen, subendocardial petechial hemorrhages means heart involvement also there, fatty liver degeneration. Arsenic will be, as it is a metal, it can be seen in the bone and hairs even many years after the death. Chemical analysis: bones and nerves should be preserved. Medical legal importance: it is ideal homicidal poisoning as it is odorless, tasteless, it stimulates a natural disease. Accidental chronic poisoning due to the consumption of tube well water with high arsenic levels. Chronic poisoning due to presence of arsenic in Ayurvedic drugs, and who are taking Ayurvedic drugs continuously for hours, they may lead to this condition known as chronic poisoning of arsenic. Arsenophages: some people take arsenic daily as aphrodisiac, and arsenic was used as murder weapons in royal families, so it is called as the poisons of kings and king of poisons. That's all today. I hope you gain some information from this arsenic. Okay, it is important, and this information is from Sudarshan book. Okay guys, thank you, meet you next time. And as you see, RH measlines, red stomach mucosa will be seen in postmortem, and RH measlines are important. Hyperkeratosis, leukomelanosis, raindrop pigmentation they will give, anemia and gangrene, these are the manifestations. Once again I am saying charcoal is not effective. Okay, this is all for today. Thank you guys.